Hello and welcome to Health Matters on Channels Television. We are so glad you could join us. I am Mary Alale Yusuf. There are now over 250,000 cases of COVID-19 in 177 countries around the world. The death toll is over 10,000, but more than 87,000 people have recovered from the virus. The death toll from coronavirus in Italy at over 4,000 is now higher than anywhere else in the world, including China. Nigeria has recorded 12 cases in total. 2, including the index case who has now tested negative to the virus for the second time, has been discharged. 1 is in Ekiti and 9 are in the infectious diseases hospital in Lagos. The last 4 cases were reported on March 19th, and the state government is still tracing and testing their contacts. My guest is a public health expert and a mental health expert. She's also the Chief Executive Officer of Maidcare Health in Lagos. You're welcome to the show, Dr. Adanze Osomonika.
Thank you for having me.
It's lovely to have you. Now, let's talk about some of the things that we're doing now in Nigeria as a result of waking up suddenly to 12 cases. At first, we had just 1, and then it's looking like Nigeria has joined the league of people with multiple cases. So they say maintain social distancing. What should that tell the common Nigerian?
Social distancing. Yeah, I have to even emphasize that we're actually not a distant when it comes to relating with each other. We like to be up and we love to hug and be in the boss situation already tells you how people connect and all that. But social distancing is basically 1 meter, which is like 3 feet from, and even especially though somebody who's experiencing symptoms, you should establish that kind of distance between you and the person. But now, because COVID-19 is also the kind of disease that doesn't show major symptoms as well, because people can be having the disease and only maybe a slight cough, slight elevated temperature.
Just like the regular common cold.
They might not feel ill. And in that state, they can still infect someone else. There was a data that came out recently from China that 4 out of 5 people said they got the disease from somebody who wasn't really showing any symptoms, So you can imagine being in that kind of state. But
so you don't know who has it?
You don't know. Basically, you don't know who has it. Exactly.
So just maintain that distance, and nobody should be offended for the meantime. Say, oh, don't you want to hug me?
We'll be greeting namaste and the rest.
So there's also this concept of self-isolation. Nigeria has put restrictions on flights from now 15 countries. Sweden and Austria were just added. So they say if you've come on a flight from any of those countries, that you should self-isolate. What does it mean to self-isolate, and what's the implication for us here?
Self-isolation is basically separating yourself from healthy people, other healthy people. Now, we were talking about it earlier in the context of if you come into a home, for example. When you come into the home, do not hug or start, having meals with everybody else. There should be a room, if you are privileged enough to have that kind of space in your house. There should be a room where you would go to separately, right? You would be fed your food, your food will be given to you in that same room. And they are not meant to even give you food in plates that everybody else is going to use.
Okay.
Disposable items, for example. There should be a garbage bag for you to be able to, as soon as you finished eating, dispose of those things.
Of the plate and the spoon.
If you happen to share, if you have to share the same toilet with somebody, that toilet must be scrubbed down before somebody else uses it. So self-isolation is just basically what it is. You would have to be communicating with people via, you keep that distance.
So this person cannot go into the kitchen, for example, begin to prepare a meal, use the frying pan?
No. Why? Because imagine you just walk into the kitchen, right? Maybe you're even just dealing with pepper or stuff like that, and you sneeze.
Oh dear.
So that surface is condemned. Somebody has to now rush in and start cleaning
wipe it down.
And start wiping down. So basically that separation for those 14 days, and eventually you're even meant to get tested out of it till they're sure that you don't have any, COVID-19 in your system, or you're not even exhibiting. The situation we're having now, from what I'm hearing, is that people come into the country, they're rushing in for meetings, they're rushing in for one thing or the other, and they're coming from these countries that are having these issues. So they come straight into Nigeria, and they're off to their business meeting.
And they don't have symptoms.
And they don't have symptoms, exactly. They're actually meant to come into the country and go straight to, self-isolate for about 14 days to be sure that you are not, contagious before you start contacting other people. My advice is that if people are coming into the country, postpone, if possible, every meeting now.
And then let the authorities know you're around.
Exactly.
Because it's a reportable thing. I came from a country that has this thing, and I'm here in your country. So the authorities should know, shouldn't they?
They should know. But we're also hearing stories that people are doing they're connecting flights, as in instead of coming straight from the UK, they will go somewhere else and fly in from there so that they won't be suspected to be coming from that country. And I feel as if we're shooting ourselves in the leg, really. The story from Italy today was so distressing. I mean, I watched a video that had coffins, for example. The virus itself has a tipping point. There's a point that you get to with cases that it's like out of control.
Yeah.
So now that we're hearing the number of cases that we're hearing, we need to nip it in the bud now. People need to get tested. People need to self-isolate. There needs to be proper quarantine. We need to do what we need to do now.
Okay. So full measure now is what you're saying.
Full measure now, exactly. Full measure now.
Now, there's a whole lot of talk around this chloroquine and hydroxychloroquine. You're beginning to laugh.
Oh,
we know this drug was used for malaria in Nigeria at a time.
Yeah.
But this same drug, we were told don't use it anymore. So what exactly will clinical trials look like?
A clinical trial, in simple terms, is an observation or an experiment in research, exactly. It's not a get up, we are saying everybody should go and use that drug. People are being, it's an approval to test certain drugs.
But what are we testing the drugs on? Human beings or animals? What really is going to take place?
Clinical trials, see, there's in vitro testing.
Okay.
Then there could be people who they suspect have cases.
Okay.
Because people have to even agree to be part of a trial. It depends on the kind of trial. There's some trials that involve humans. There's some trials that involve what you call, because you have a group sometimes where you give them placebo, and then the group that you give the actual drug to see. It's like you'll be comparing experiments.
That's right.
That's basically what it is. I can't say the level of are they testing it on actual
how
people,
involved it's going to be.
Involved it's going to be. But it's actually just a trial. It's still a trial.
But it's not a ticket. It's not. You're not telling people to go out there and buy chloroquine. Now, I'm hearing rumors. I don't know how true that people are taking chloroquine. It's flying off shelves. That it's not supposed to be on in the first place, and people are coming in with chloroquine poisoning.
Yeah, that's a
Is there something like chloroquine poisoning?
There is such a thing as chloroquine.
What does it look like?
It can be as bad as blindness. Okay, try and imagine back in the day when people would take, maybe like you were sick with malaria and you took a lot of chloroquine. Some people even have this sound, this numbing sound in the ear.
Oh, I know of someone
Remember
who told
all those
me
kind of things?
She was deaf for 3 weeks.
Exactly. These things that we're saying, they're foreign bodies, they are drugs. Do you get? So we can't look at chloroquine now. Chloroquine, people are cracking jokes that chloroquine is now a hero. It's not a hero. Oh, it was forsaken in the past, now it's come back. No. Let us wait for the actual results and wait for WHO to announce that we can actually use hydroxychloroquine for the treatment
which is different from chloroquine.
Which is different from chloroquine.
Okay.
But people are saying because they've seen that there is no report from the World Health Organization saying that we can actually use it. We're hearing stories here and there. Some people have used it. It tries to impede. I mean, I watched a video, somebody saying something about hot sauce, drink hot sauce, and then COVID-19 will just go away. We will hear all sorts. People will still even go and still, even after this interview. But
concerning this hydroxychloroquine, they are saying that it has something that prevents the COVID-19 from attaching to receptors in the body. Is this a scientific thing?
Until the results are out, right? We can't really... such things are still speculations because as tests are being carried out, as clinical trials are being carried out, changes will be made. It's just like being in a lab, for example. Oh, we saw this, it worked on this. Oh, we tried this. Oh, and then they'll be adjusting things as we go along. COVID-19 is new. So we're in uncharted territory, let me say it like that. So we're learning as we're going along, you know. There were stories of the virus mutating. When it first came out, people were saying it couldn't survive in Africa. Behold,
well, here it is.
Here it is,
in
you know.
12 people.
So people should know that at this time, we're in uncharted territory, peculiar times. So the more we listen to the health authorities, listen to WHO,
the better for
what
us.
are they? They are the ones that are actually carrying out the experiments. I mean, is there anybody in Nigeria who has conducted a clinical trial on chloroquine or has people who are ready to agree? There's a whole process involved.
I, for one, will not agree because the itching. Oh,
involved.
I remember that itching. Can't go near that.
You know.
How long do you think these trials might last?
From what it could go, trials can take, it can go from as much as weeks to months. There are some trials that have gone on for like 6 months or even more. It just depends. I think everybody's working, from what the report I got, they're working as fast as they can, you know, but it's not something, this is a marathon, it's not a sprint. Let's just say so where we have to hunker down as much as we can. People are saying April 30th and all that. We have to hunker down as much as we can till we ride out this journey, we ride out this wave. That's just the thing. So,
okay. Yeah. What kind of psychological help do you think somebody who is positive with COVID-19, do you think such a person will need? Or it doesn't need any such thing? After all, they said it's only 2 weeks that it lasts in the body anyway.
There are people who don't even have the COVID-19, they're experiencing anxiety, stress, you know, some kids that we were telling some parents that you need to explain to your kids why they're even home now. Why am I at home? And it sounds, you know, strange to everybody. So
that's true. Nobody thought about telling the children.
And the children have different ages, different stages. So like the teenagers, is a certain kind of approach you would approach them with. They will need to still stay connected online to to the people that they're connected with. The middle school children, get them busy by, you know, all games they play, things they're learning.
Okay, this is part of the psychological treatment.
Yes, the psychological treatment. The very, very young ones, they spend time. Because a lot, you know, before this whole time, some parents don't hardly spend time with the youngest. Now they're stuck with their children.
Suddenly, mommy is around all day.
You know, do things together. We're encouraging people to find new hobbies, you know. Now it's time to look around your house. Some people are even doing COVID-19 spring cleaning. Now suddenly realize, you know, but somebody who's experiencing COVID-19 at this time, yes, the person needs like a lot of positive encouragement. Let people know that we're in this together. One theme that keeps going around abroad is that we're in it together. We're in it together. It's not your disease. It's not, you know, it's not you going through it.
But those who went to the beach to sunbathe, we're not thinking they're in it together with anybody.
Those guys said their own storyline was that they're young and that it affects old people, so it doesn't affect them. But we had people now actually telling them that, look, it's not about you. It's about the other people connected to you. If your grandmother stays with you, for example, you know, you'll be shouting at the beach, and then you catch it, and then you go home, and your grandmother, and you pass it on to your grandmother, who ends up with a severe case of COVID-19. Would you be happy? And they were like, okay, you know, but you know, this kind of thing. Some people say, I want to live my life, I want to live my life. But truly, we're in this together. And if in Nigeria, we can look at it that same way, we're in this together. So anything you're doing...
Let me cut you there and take a short break.
Yeah.
We are going on a really short break now. Hang around and meet us on the other side. Welcome back. This is Health Matters on Channels Television, and we're discussing COVID-19. Who isn't discussing COVID-19? The number to call if you have any question is 0805-468-3514. That's 0805-468-3514. You can also tweet at CTV_Mary A. And I have the first tweet from you, from George Benson. He's saying, Nigeria is a country with the majority of whom are poor people and live in one-room apartments. So please talk about how people living in such conditions can self-isolate.
I thought about this thing earlier, and I was thinking, okay, yes, we have one room, right? But, you know, what is happening during this time of COVID-19 is that everybody's getting creative. So the actual advice would be, in that same one room, everybody can hunker together. There must be a part that is separated.
So you carve out a little portion.
You carve out a portion for the person there. You know, but it's at the danger of, like, if there's no ventilation in that one room, and he or she starts sneezing, or he or she starts, you know.
There is that.
You know, because at the end of the day, you might as well just, it's hard to say, but everybody might have to move out of that room and leave the room for the third person who is just maybe go, because it's not forever. It's just for some days or rather like 2 weeks. So they might have to leave that room for that person. When that person is done with their process, the room itself has to be sanitized all over again.
Let's speak to Moshood from Osun State. Hello, Moshood.
Hello, good afternoon.
Good afternoon. What's your question?
Yes, I have 2 questions for Madam Elias. Number one, the case of COVID-19 didn't start in Nigeria, and likewise not in any other countries. It started from China, specifically. And then we've been hearing the names, but also it just entered Nigeria. So, Madam Elias, please, what's your advice to government when it comes to bring proactive before any control?
Hello, Moshood. I'm afraid we can't hear you. If your TV is on, you've got to put it off.
Hello, can you hear me now?
Just faintly. Put your TV off. This is much better. Go ahead.
I have questions for Madam Elias. Number one, what's the advice to government when it comes to being proactive on the issue of African diseases? Number two is that, I've been talking about the issue of
What, Moshood? Please hang up and call again. Something is wrong with the line. It's cracking along the way. But do try and call again. Thank you. So, the DG of WHO was saying some things about lifestyle, some lifestyle changes or some lifestyle patterns that might improve one's immunity in the meantime for those who haven't got the virus. What are some of the things that one can do? Apart from smoking, which I got really clearly, stop smoking.
Stop smoking, stop drinking, stop self-medication. Yeah, that which is very key. But healthy-wise, right? Healthy diet, vitamins, fruits, things to beef up your immunity. If you've never cleaned, if you were used to cleaning your house, now is the time to clean, really, really face hygiene. Clean your house. Make sure everywhere is, sparkling. Let me just say it like that. So when you talk about healthy lifestyle, eat healthy foods, quit drinking, quit smoking for now, and and then make sure you're taking your vitamins. Yeah.
Let's try and get John from Abuja. Hello, John.
Hello?
Yeah, what's your question, John? Hello. Welcome to the show.
My question is this. Our children going to primary schools, how do you tell them, indicate them about how to prevent COVID-19?
Thank you very much. John is calling from Abuja. Okay. I wonder whether schools are closed there.
That's because I was surprised.
Because schools are closed here. But let's address this question. Let's just assume a child is going to go to school. How do you tell a child about COVID-19 and what he should do?
Okay, first of all, sit the child down. Let them know that it's touching, hugging, kids, because one thing about kids is that they're constantly touching each other. Let them know. You can also even give them a time and say, okay, every 10 minutes or every 20 minutes or go and wash your hands. Okay. Wash your hands, make sure there's soap. Because in some schools, before you even walk into the school, they have something set up for the kids to actually wash their hands. So
I hope they have sanitizer around the classroom.
Another thing we're even telling parents, if you can, put a little, bottle of sanitizer into the child's bag, all the better. So you can tell the child that, look, every 30 minutes, every 20 minutes, whatever, apply your sanitizer. Once you find out that you've had contact with anybody or contact with the surface, apply your sanitizer. But you have to really talk to the child, so the child doesn't now become, is either giving everybody sanitizer or he's over squirting it around. Sanitizer.
No, you see, over squirting, I don't think we can do anything about that. I remember during Ebola, children were having the time of their lives, squirting the sanitizer and just using it. But can you tell a child, don't touch your face?
You should tell the child whether the child will listen, because what we're saying is don't touch your eyes, don't touch your nose, don't touch your mouth. But kids will still do these things, which is the essence of the backup is like the sanitizer.
Yeah.
You know, they will still put things in their mouths. They will still, you know, so all these other aspects are backups. Make sure that they tell them, go and wash your hands, go and wash. Make sure you always wash your hands.
And I think the
And I think even
sanitizer in the bag is a very good idea.
Very good idea.
Very
and
good
if
idea.
the teachers can reinforce what the parents have told them at home, that would be better. If the constant reminder, there was a document I think I sent, which I got recently, of explaining COVID-19 in a childlike way. And it was so simple, with pictures. You can even get creative as a parent. Put up pictures, tell them in a story fashion.
Sorry to cut you there. Let me quickly take Hakeem. Hello, Hakeem. Oh, that sounds like we lost Hakeem. Try again, Hakeem. All right, so then exercise.
No, exercise is actually is almost like the elixir to so many, the cure to so many things. Yes, get some exercise.
That might be a good pastime for somebody who feels like climbing the walls from being isolated.
But even as you're going for the exercise, you know, during exercise, people sweat and all that a lot. So don't, you know, as in, you still have to maintain social distancing, even in the exercise, you know. So if you're going to go to an aerobics class, everybody still has to maintain some kind of, you know, social distancing. Or you're going to go running in your neighborhood, go walking within your house, create a space where you can, you know, work out that, you know, or that excess energy from being off. I'm not used to being in one place, you know. Get creative, read a book. Truly, people are getting creative. You have to actually get creative during this time. Read a book, connect with somebody, call someone you haven't spoken to in ages, you know.
And have a nice talk.
And have a nice talk.
I'm getting a question from Engineer Salim. He says, Doctor, I'm really scared because some people in the North don't believe in this COVID-19 pandemic. Wow. What I keep telling such people is go and watch the news. What can he do to make them believe? But I hear this every day, that some people don't believe there is a pandemic.
You know, when it comes to, I think when people have told themselves, and this is the mentality that we're talking about, once people are thinking like it doesn't concern us, it has to do with outside the country, it has nothing to do with us, that is the wrong mentality and it's the wrong attitude to bring up, you know. So people at the point, people are saying HIV didn't concern us, but behold, here it is.
Let me quickly take this call. Hello, Ada.
Hello, good afternoon.
Is calling from Akwa Ibom. What's your question?
Please, I want to know what are the precautions that one needs to take just to avoid the spreading of the virus?
Capital, Ada. Let's do our precautions. We can never do too much of it.
Can never do too much precautions. Hygiene. Wash your hands constantly. Use sanitizer when you can't get water. Don't touch your nose, your eyes, and your mouth. Make sure that you're taking your vitamins. Make sure that you're eating healthy. If you do have a cold, that's the time you're meant to wear a mask. Or if you happen to work in the health industry where you have to treat a lot of sick people, that's when you should wear a mask. I see people wearing masks and there's nothing wrong with them. That is not the time to wear a mask because you are now depriving people who actually need the mask from getting it. Yes.
Let me quickly read this while I do believe that the hotlines will be shown now because if you're on isolation, you've got to have these lines so that if you have any symptoms, you can call. Yeah. Now, Jackson is asking, how effective is lime and lemon in fighting COVID-19?
Okay, guys, we need to make it straight, first of all, that all these, let's stick with facts when it comes to COVID-19. You're taking lime and lemon, you just want to take lime and lemon. Lime and lemon has not been designated as the fruit of choice to prevent or heal.
Or heal, especially not heal.
Garlic has not been designated as, it's going to heal COVID-19 or I've heard words of hand dryer. Someone said put a hand dryer up your nose. It will, you know, as in. I've heard
I've got to cut in there. Thank you so much for coming to the show. It's been a wonderful one. Thank you for being with us today and for all of you who called, Hakeem, John, Moshood, Ada, everyone and else. Have a wonderful day. I'm Mary Alale Yusuf.